Chief Floyd, can you explain a little bit of what is going on today?
Sure, I'd be glad to explain what's going on today. And I want to thank you for allowing me the time to speak with the media so that I can inform our people the situation in health and the actions being taken today. This is Friday, the last day of the fiscal year. As you might recall, last week the council approved the authority and the agreements for the operations of the healthcare system for 2017. The restructuring part of that is the last steps of the restructuring is what is occurring today. And there will be people that some will be transferred to other positions, and unfortunately some will have to be let go. So I thought as principal chief they need, all our people need to hear from me about the background of that, and so welcome this opportunity.
Can you tell us who is going to be affected and about how many people are going to be affected by this?
Because of the personnel actions that are taking place, I can't by name say, and to be perfectly honest, I don't know all the names. For about 6 to 7 months now, the health department has been going through many options regarding our path forward. And the expense that we have, particularly with the expense of personnel, can't be sustained with the money that we have, both with the collections that we have coming in and all sorts of revenue, and also the appropriated money from the National Council and from the Indian Health Service. It's just the fact that we had too many costs. And it's very unfortunate. And so today, we have the health department staff meeting with our staff throughout the nation and the hospitals and clinics, explaining to them the decisions that have been arrived at and the actions that must be taken. It's unfortunate. We have some very good people working for us, and I think they're doing great things in providing care and support to patient care throughout the nation. But for our system to survive, we have to make sure that we reorganize in a manner that we can even be stronger in the future. And this is one of probably the hardest steps to take today. And so, it wears on me, I think, as much as anybody else. All the staff have been on my mind. We try to do the best we can every day. And I think being responsible at this point is the thing that we have to do. And it's just unfortunate that it involves people. I know it'll be disrupting, jobs and families, but we can still ensure that come Monday morning, we have providers in place. We're providing quality care. We have the access for our patients, and the system will be established in a way that responds to their needs. We do have some positive things going on with the construction of the hospital and the clinic in Okemah. We'll be starting the construction at Eufaula soon. So, this moment when things are very tight will pass as we begin to get reestablished with more resources to take care of more people. And that's what I think is kind of the most telling and important thing about this is that, in 12 to 18 months, we will have the opportunity to bring people back. But at this point, we just don't have the means to keep everyone in place.
And I know you can't list names, but is this over a variety? These individuals over a variety of facilities? Is it secluded to just a couple of programs or services? Can you elaborate on that?
Well, I know one of the top priorities was to reduce our overhead, and so administrative positions and administrative support positions all along are positions that we knew that we needed to eliminate to guarantee that we had providers and clinical staff in place to take care of patients. And so this is all levels of the organization and throughout the system. And so I think we had to be equal and have some equity in the decision making so that one part of our system didn't take the blunt kind of the decisions of reduction that others may have. So again, to ensure that Monday morning patients can go in and see us providing care, I think is, how we can reassure our people that the decisions that have been arrived at have not just been very sudden decisions, but much thinking, much projections, looking at a lot of data, talking to people to arrive at where we are today.
What is being done for these individuals that you're having to let go? Is there a severance package, and kind of how is this situation being handled?
I personally signed all the letters that they will be giving to staff, whether they're transfers or whether we have to, dismiss them from work. And they do have, the tribe will make sure that they're compensated for any unused leave that they have and their savings that they may have in their 401k that the tribe has. So those things will be available to them. HR will be processing those in the next few days, and so that's significant in some cases, and so they will receive that. I'm not sure about unemployment since we don't really control that. That's interaction with a contractor in the state, so we'll see where that goes, but they can certainly apply for that, and we'll do everything we possibly can to support them in that manner.
Are these layoffs in addition to the transition that's currently going on in the Department of Health with merging the human resource and IT and finance functions, or is it kind of, I guess my question is it additional or is it the same individuals that are going to be affected?
Well, the realignment is coordinated across the nation. We can find economies of savings with the you can call it just exact wording, but as we restructure and merge some of the programs, that's allowing us to keep some staff on that would have been laid off. So these are all coordinated. We had some inpatient services that were way underutilized that we will be merging into, in some cases, the facility here in Okmulgee and from the rehab center. So they'll be still available to people, but when you have the cost of the overhead of 5 inpatient units that we had, when we really should only have 2 to 3, we see savings. But unfortunately, we don't need all the staff that we had to fulfill the needs of our patients.
As far as the citizens in the community are concerned, what services will be affected, and will we see any closing of facilities?
Well, the only things that the patients should notice is that we're continuing the same level of care. Same quality of care will be provided as well. And hopefully many of the same people that they saw today, they'll be seeing on Monday. Now, with the merging of inpatient units, because we're licensed by the state, we have to submit and get approval, which we have obtained from the state, of closure of units. But it doesn't mean that entire buildings are closing, just the units. But those units, those services that are being provided in remote locations will be provided here in Okmulgee at the Memorial Hospital.
So am I right in saying that the inpatient facility at the rehabilitation center is going to be closed, and those services will be moved to the medical center here in Okmulgee?
The rehab center will remain open, but will be strictly outpatient. And the bulk of our work there is outpatient. So I think the average citizen walking in will notice no difference there, because the overwhelming majority of our work is done during business hours. Very few patients occupied any inpatient bed, and that's one of the problems that we had, was the very low occupancy rate. 0, 1, or 2 patients. And when you have a full complement of staff and we have no patients, we've tried that system now for 6 months and not seen an increase. We just can't sustain that. And so, I think that the National Council has been very patient with us as we proceeded. They've been very supportive as we have proceeded because we have been very detail-oriented and been open about this process with them all along. So the doors are not going to be padlocked or anything like that in any of our buildings.
How will our health department programs and citizens benefit from this change? And do you have an estimate of how much money the tribe will save by these changes?
Well, the savings overall will be really reapplied. So it's not that we're going to bank money and put it in an account. I wish we had the luxury of having money in an account. The recent action by the National Council to allow us to enter into the letter of credit agreement is merely to catch us up on paying bills that some of which exceed 2 years. So when we have debts that have been going on for more than 24 months, we have to address them very quickly. And so some of that money that we are having available is just going to go repay bills that are already past due, not to bank and save for, that would be a luxury. We don't have that luxury right now. We hope that through the improved collections that we have, which are about $5 million a month now, that is going to really be our leverage into the future and helping to, strengthen and sustain our system.
What is the timetable on these layoffs, and will there be any more layoffs within the health division or even within the rest of the Muscogee Creek Nation?
Within the rest of the Muscogee Nation, there's nothing on the horizon there. Within the health department, I believe what you're seeing at this point really is the tail end of the things that we will be doing. There may be a position or so in the future, but none is planned. So at this point, we're really concluding that part of the decision-making and measures that we have to take so that that we get a baseline for the healthcare system and build up from there.
Talk about what led us, how did we get into these circumstances, and why are we having to lay off people?
I wished I could answer that question of all the circumstances. I don't know all the circumstances. When I walked in the door as the principal chief, I estimated we were about $28 million in the hole. As you can now find out, we're more than double that amount. And so there have been some surprises, and not pleasant ones. My job and my responsibility, and I feel my responsibility to the citizens, is to be open about it. We've been transparent in reporting on a quarterly basis to our citizens in the reports and making those choices that we must make so that the system remains strong and vibrant in the future. And that's been the utmost thing on our minds, and the quality of care must be there for every citizen or any person who accesses our system. And I think I can sit here and assure people that it will be. And today, Monday, we began the whole new approach at a baseline, and we work up from there. And I think that, again, the patients will see that we have providers in place, providing the quality of care they expect, and we'll keep moving forward.
One of the things we've previously covered at Mvskoke Media is the audit and the deficit and things that have appeared. Is this a result of the 2015 audit that has kind of come in, and how do you get to how did you see the deficit? What documentation led you to that?
Well, the 2015 audit was, in my view, kind of the first marker that I saw, because it indicated that we were in a deficit. I think at that time about $15 to $16 million. Now that we have the 2016 audit in place and that amount nearly doubled, then it validates what we have uncovered through talking to people, analyzing the data that we had, looking at financial statements, income statements, and things of that matter. And we knew that we had opportunities, but we knew that we had to overcome this deficit and address that so that we could move forward. Because, we have in the private sector people and businesses that depend upon us. And when we haven't paid them and we owe them now at this moment, we've got to make good on our debts. And unfortunately, the sad part of the whole thing is the measures we have to take to address them and move forward.
One of the things that was listed when Creek Nation went to the council to ask for a loan, to fix the deficit, was poor planning on part of the Department of Health in acquiring facilities. Would you say that those items led to this moment today?
I would say that the items that were brought to the attention of the National Council originated from the 2015 audit and also appeared in the 2016 audit. So any person can look at that and derive that themselves. It validated, like I said before, some of the thinking that we had, and served as a kind of a roadmap for us to make the corrections that we needed to make. And so, again, the National Council had been very patient with us as we made sure we feel that we've got things right so that we could move forward and not be going back to them again. And 2017 is the year that we have to make everything balance.
Are the layoffs one of the recommendations? I know we've hired consultants for the Department of Health that are going to be with us to kind of revamp the department. Is this part of the recommendations, is that we lay off some individuals?
Yeah, I would refer back to the document that was generated back in February or March. During that time period, some of the options that were available. The consultants have come in, the two consultants that we have, and looked through those options and advised us whether those were options that were being in our best interest in the future or not. And so in that regard, they've done their job. They've looked at the data, they've spoken to accrediting and licensing agencies on our behalf, positioned us in a manner that we make the right decisions going forward, and we followed their advice. And we needed that because the Creek Nation healthcare system is a very complex system of multiple inpatient facilities licensed by the state of Oklahoma, in addition to federal Medicare licensure, and we serve Indian and non-Indian patients. And so it's not what you would see in some other tribes that merely see maybe even just their tribal members or Indian people. We're very much a private business operation that you would see in any other system, even like St. John's. We're comparable to that size. So you have to apply the same principles. And that's, I think, what may have been missing in the past. As I came in as principal chief and we brought people on to address the issue, yes, we did look at the past, but we had to plan for the future. And that's where most of our energy has gone.
When the George Nye Rehabilitation Center was acquired by the nation, that part of our agreement with the state was to keep that open as a service to people in the rural area around Okmulgee so that people didn't have to go to Oklahoma City or Tulsa for services. How is closing the inpatient facility at the rehabilitation center, how do you think that's going to affect the community? And is there any changes at the former Okmulgee Memorial Hospital that might affect the community as well?
Well, let me talk about the George Nye Center first. I think by the time we obtained it, the trend of the usage by patients to other facilities in Tulsa and Oklahoma City had already started. And we've seen the decline in usage not be that steep because by the time we took possession of the facility, I think they had hit a baseline. What we've seen is that baseline just stays straight with very few patients coming in. And so I think the state recognized that as well as probably one of the issues they considered when they started talking to us. And so we inherited that. It's a good facility. There's some good staff there. It has some good potential. We just now need to reorganize that in a way that we meet the outpatient needs of physical therapy. So again, as most of that is done during the daytime, is to bring that daytime business into our facilities. We have the only pooled therapy center in this county, and it's not being fully utilized. We can change that. And so recognizing those things is an important part of this overall change.
And then what about the Okmulgee facility as well? Or the hospital?
The Muscogee Hospital now is going to play a key part of our future. I know personally, even as a candidate for principal chief, I was very skeptical about that. But the realignment allows us to fully utilize that facility. We have administrative staff there. We've talked about the George Nye Center, those inpatient requirements that are low, but can still be met in the Okmulgee facility by the change in licensure, allows us to continue to serve our patients. We have seen an increase in the emergency room activity there, and so we're going to proceed with working on organizing that facility so that going forward, that is going to be a key piece of our healthcare system. It won't be cheap to go back in and rebuild that facility and remodel it, but we pretty much have to do that because overall it will be a savings to the tribe in the long run. So, I think that's where you get into some scenarios where it looks like we're at conflicts with each other because, maybe changing the inpatient licensure at George Nye, also changing Okmulgee, is to incorporate that, and then laying off people and trying to invest in the infrastructure at the same time. They seem in conflict with each other, but they have to be done so that we can assure that as we move forward that the hospital here in Okmulgee is configured in a way to meet the needs of the people. There's going to be a good facility, a clean facility, and a strong facility as we go forward. We've got some great services there, but some of that space needs to be remodeled.
Why do you think this is the best plan for the nation to move forward by laying off individuals instead of maybe closing a facility or selling off a facility or another plan altogether?
Well, the plan that we have in place is really built upon expansion. We will have the Okemah facility completed by the end of this calendar year. By next spring, we will be we'll have fully moved in and occupied that facility, and it will be operating. The Eufaula Clinic is scheduled to begin construction in November and will open about 18 months later, and will be fully utilized. We're now in 5,000 square feet at Eufaula. We'll be in 170,000 square feet in Eufaula. So the long-range view of our healthcare system looks very promising. Yes, we've had to go back in and re-engineer both locations so that we make sure that we have value in those facilities and not extravagance. And so, we have cut some costs there, but guaranteed that, we're going to have very fine facilities for our people. And so as we make these changes, one is kind of dependent on another. And so, again, we're at a point, it's almost like a little pinch point here where everything kind of comes to this crossroads that we have to make decisions at this time, go past that area, get into the future, and begin our plans for expansion.
Is there anything else that you think citizens need to know about what's going on today?
Well, I want to make sure our citizens know that, I'm totally responsible for this, that as a principal chief, I have to sign off on everything. And believe me, it wasn't done in haste. It was done with a lot of deliberation and a lot of input from a number of different people, a number of different sources. And so, they may get upset with some of our staff, but, I'd love to hear it if they have any complaints about it. Any ideas, any input for the future, please avail themselves to me because I'd love to hear it. But I also want to guarantee to our people that, we're striving for the best quality care they can get in our healthcare system. And the way that we're organizing will set us up so that we are a high-quality organization providing great healthcare services to the people who use our system. We do need them to use our system. Our numbers need to go up. And we will work on the other aspects of it, like generating revenue, making sure that our bill payment is current, making sure that we have the latest technology available, and those things are being worked on as we speak. That will set the platform for a successful healthcare system for the future.